Hello everyone, this video is about rabies. First about rabies virus. Rabies virus is a bullet or rod-shaped virus. It contains a single stranded RNA and it is an envelope virus. It belongs to family Rhabdoviridae and it is a type of neurotropic virus, which means it targets nervous tissues. Some examples of animals that can harbor rabies virus include dogs, raccoons, cats, foxes, skunks, monkeys, bats, and etc. The mode of transmission of rabies virus to humans is through direct contact between viruses in contaminated saliva of the animal with the mucous membranes or wounds of the human. The human infection happens due to transdermal bites or scratches from infected animal or inhalation of virus containing aerosol like in bat caves. There has been no any recorded cases of human to human transmission of rabies virus. Rabies is one of those diseases which is 100% fatal, which means once the symptoms appear, the chances of death is 100%. But it is also 100% preventable through vaccination and awareness. It is a serious public health problem in over 150 countries. Globally, there are an estimated 59,000 deaths from rabies annually. However, due to underreporting, the documented case numbers often differ from the estimated numbers. 99% of human rabies are from dog bites, and the frequent victims are children between 5 and 14 years. The symptoms of rabies in pets include loss of appetite, behavioral changes, changes in sound, drooling excessively, biting the site of the wound, overreacting, becoming paralyzed, staggering or falling, and once the pet shows symptoms, it will usually die within 7 to 10 days. The incubation period of rabies is 1 to 3 months, but it can range from 1 week to 1 year. The initial symptoms include low grade fever, chills, nausea, vomiting. Then it slowly progresses to two major forms of rabies. Number one is encephalitic or furious rabies, which is more common in humans. And next is paralytic or dumb rabies. The symptoms of encephalitic or furious rabies are hydrophobia, which is the most characteristic feature. This means fear of water, aerophobia, which means fear of air, excitation, aggression, confusion, excessive sweating and salivation, hallucinations, and death occurs in 2 to 5 days. The features of paralytic or dumb rabies include flaccid paralysis, loss of reflexes, hydrophobia is not seen here. There is ascending paralysis, which subsequently paralyzes the respiratory muscles, and death occurs in 1 to 2 weeks. The chances of disease following exposure depends on the severity of the wound, location of the bite, where the anatomical location of the bite increases the chances of rabies, the quantity of virus inoculated, and timeliness of post-exposure prophylaxis. The WHO has classified exposure to rabid animals into three categories: Category 1, Category 2, and Category 3. The Category 1 includes touching or feeding of animals or animal licking on intact skin, and this is classified as no exposure. In Category 2, it is nibbling of uncovered skin or minor scratches or abrasions without bleeding, and this is classified as exposure. In Category 3, single or multiple transdermal bites or scratches, contamination of mucous membrane or broken skin with saliva from animal, exposure due to direct contact with bats, and this is called as severe exposure. Now, in post exposure prophylaxis, in case of category 1 exposure, no any PEP or post exposure prophylaxis is required. On category 2 exposure, first we should do wound washing and then immediate vaccination. On category 3 exposure management, there is wound washing followed by immediate vaccination and then rabies immunoglobulin administration. The components of post-exposure prophylaxis consist of local wound treatment, rabies vaccines, and rabies immunoglobulins. On local wound treatment, thorough washing of the wound area with soap and plenty of water for 15 minutes. If local irritants like herbs, oil, chili, or turmeric powder have been applied, this should be removed by thorough washing of the wounds. Local antiseptics like povidone iodine can be applied on the wound. Avoid suturing if possible. If required, use Rabies immunoglobulin into the wound. Wait for a few hours, then apply minimum sutures. Use tetanus toxoid vaccine and antibiotics as necessary. Now talking about rabies vaccine, we give rabies vaccine to all the animal bite victims of category 2 and category 3 exposure. We give them irrespective of age and body weight. All require the same number of injections and dose as per injections. The shelf life of rabies vaccines is more than 3 years and it is stored at +2 to 8 degrees Celsius and protected from sunlight. After opening the vaccine should be used immediately or within 6 to 8 hours if kept at temperature of 2 to 8 degrees Celsius. The rabies vaccine can be given through intramuscular route or intradermal route. As you can see in this picture, when given through intramuscular route, the needle is held 90 degree to the skin, whereas when given through intradermal route, the angle between the skin and the needle is 10 to 15 degree. The intradermal route of rabies vaccine is the more preferred one, where the dose is 0.1 ml of the vaccine. On intramuscular dose, entire vial of the vaccine, irrespective of the vial size, is given, but this method is usually not preferred. The intradermal dose is given over the deltoid region. Here in this picture, you can see the intradermal injection of rabies vaccine. So finally summarizing the rabies vaccine, the dose is 0.1 ml on each site. Route is through intradermal route. We give them over 1 week on day 0, that is immediately after exposure, on day 3, 3 days after the first dose, and day 7, 7 days after first dose. And we give 2 intradermal injections on both the deltoid region. About safety of rabies vaccine, it can be safely given to pregnant or lactating women. It can be given to HIV patients, and the doses are same for all ages and gender. Rabies immunoglobulins provide neutralizing antibodies at the site of exposure before patients start producing their own antibodies. They are applied locally at the site of exposure or at the site of wound. It is administered only once. It is given preferably at or as soon as possible after initiation of vaccination. It is given into and around the wound site. However, it is not indicated beyond the 7th day after the first dose of rabies vaccine. Rabies immunoglobulins should be stored and transported at a temperature of +2 to 8 degrees Celsius and should not be frozen. The maximum dose of human rabies immunoglobulin is 20 international unit per kg of body weight, and equine immunoglobulin is 40 international unit per kg of body weight. The total recommended dose of rabies immunoglobulin must never be exceeded, as it may suppress the antibody production stimulated by rabies vaccine. The maximum total dose of rabies immunoglobulin to be used are: for human rabies immunoglobulin it is 1500 international unit, and for equine rabies immunoglobulin it is 3000 international unit. Rabies immunoglobulin should never be administered in the same syringe or at the same anatomical site as rabies vaccine. It must never be given intravenously. It is stored in the refrigerator, which should be brought to room temperature at around 25 to 30 degrees Celsius before administration to the patient. And we need to observe the patient after giving rabies immunoglobulin for anaphylaxis. Now let's talk about post-exposure prophylaxis for re-exposure cases. For re-exposure cases, the categories are all the same. That means they are divided into three categories, category 1, 2 and 3. In case of category 1 re-exposure, no post-exposure prophylaxis are required. In case of category 2, we do wound washing and immediate vaccination, but rabies immunoglobulin is not indicated. And also in case of category 3, we do wound washing and immediate vaccination, and again here rabies immunoglobulin is not indicated. No vaccinations are needed if previous exposure is less than 3 months, which means if the patient has already received post-exposure prophylaxis in the last 3 months, no vaccination is needed. So the dose of rabies vaccine for re-exposure cases is 0.1 ml, again given intradermally on day 0 and day 3, and it is injected only on the one side of the deltoid region. Observation of biting animal. Suspected dog or cat is caged for 10 days. If infected, they will die within 10 days after appearance of symptoms. If the animal doesn't die in 10 days, it can be let go and it is a confirmation mark of no rabies. There is no record of transmission of rabies from consumption of meat or milk from a rabid animal. For prevention from rabies, vaccinate your pets, dogs, cats, livestock once every 3 years. Control stray pets and do not touch or handle wild animals even if they are dead. Now let's talk about pre-exposure prophylaxis. World Health Organization recommends pre-exposure prophylaxis for individuals who are at high risk for rabies exposure. Subpopulations in highly endemic settings with limited access to timely and adequate post-exposure prophylaxis, individuals at occupational risk like veterinary doctors, and travelers who may be at risk of exposure. The vaccine regimen for pre-exposure prophylaxis is the dose is 0.1 ml on each site, route is intradermally, it is given on day 0 and day 7. Two injections are given on both deltoid region. Thank you.